Good evening, and thank you for tuning in to our event tonight about COVID-19 vaccines in Chicagoland's Black communities. I'm Natalie Moore with WBEZ, and we'd like to welcome our viewing audience from WBEZ and our community partners at Something Good in Inglewood, the Chicago Urban League, South Suburban College, Austin Coming Together, and the Theta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. This event is part of WBEZ's coverage of COVID-19 vaccines and racial equity. We'd like to thank the Pulitzer Center for its financial support of our journalism. And we also want to thank our community partners tonight, who I mentioned earlier. We all work together to collect community questions for tonight's event, and they also provided promotion and are co-live streaming with us right now. Our goal tonight is simple: to answer your questions and address your concerns about COVID-19 vaccines. As you know, the pandemic has disproportionately hurt Chicago's Black and Latino communities. So our job is to get you factual, verified information about vaccines and to ensure that vaccine resources get to communities that were the hardest hit by the pandemic. Almost all of the questions for our panelists tonight come from you, our audience, or from our community partners. We'll also be taking in live questions posted on social media tonight. And before we get too far, we want you to take part in the conversation. We can't be together, but we have the chat. There are a lot of rumors and misinformation out there about the vaccines. So we want to know what you have heard about the vaccines from people you know, and we're going to do some fact checking later on. Give us some examples in the chat and we'll address some of them later in the program. We've got so much to get to tonight, hearing from people who got the vaccine, the people making decisions about how it's distributed. But first, I had the opportunity to talk with a very special guest just a few hours ago about addressing some of the questions and concerns we've been hearing about vaccines in the Black community.
Hi, it's Kamala Harris. How are you?
I'm good. Natalie Moore, WBEZ. I first have to say one thing to you, HU.
You know, we're everywhere.
We are everywhere. Vice President Kamala Harris, thank you so much for the interview. The timing is serendipitous. Tonight, I am hosting a WBEZ virtual event about Black people and the COVID vaccine, focusing on hesitancy and access. So we're glad to be able to share some of our conversation. When we talk about vaccine hesitancy in the Black community, it goes far beyond the infamous Tuskegee experiment. What are you and the administration doing to overcome historical medical distrust that some Black people have?
Well, first of all, let me say that I appreciate that you're going to be covering this topic. More than 2 in 3 Black Americans personally know someone who has been hospitalized or who has died from COVID-19. So this, is a real issue. It is literally killing the community at highly disproportionate rates. The suffering, the grief is immeasurable, not to mention the economic impact and the educational impact it is disproportionately having on the Black community. And so we have to address it, we have to deal with it, and we have to look at a number of issues, both in their historical context and in terms of what is facing us clearly right now as present issues. In terms of the history, well, look, the Tuskegee experiments, we can go through history and know that that there is a righteous reason for folks to be skeptical when they are, and if they are, as they are, aware of the history on these issues. And we must always speak the truth about it. We should never forget it. But on this issue, in this year of our Lord, 2021, folks have got to take this vaccine when it is their turn. It is safe and it will save lives. There is an extraordinary scientist, Dr. Kizzy Corbett, who helped create the vaccine. She is a Black woman, in addition to being an extraordinary scientist. I have taken the vaccine, so many of us have, and literally, we each have it within our power that when it's our turn to get this vaccine, it will save our lives, the lives of our family, our friends, and our community. And we can't afford to not take advantage of this when it is our turn. We just can't.
Access is also an issue in communities of color, with many Chicagoans who are eligible but can't find appointments. Yesterday, President Biden said every adult can get a vaccine by the end of May, but what is the racial equity plan around access?
Right, and that's right. You know, and I will tell you that I think that the access issue is increasingly becoming the issue, or more of the issue than hesitancy. Because in my travels, mostly virtually these days, but in my travels, folks are saying, "I want the vaccine. How do I get it?" So one, we recognize that when we look at the disparities around who is actually getting the vaccine, yes, there is some hesitancy, but we also want to make sure that there's not an accessibility issue. We created a task force. We called it the COVID-19 Equities Task Force, headed by Dr. Marcela Nunez-Smith, to actually, in real time, track who's getting the vaccines and making sure that everyone who is entitled is actually having it in a way that is accessible to them and available to them. We have, for example, dedicated vaccines to community health centers, 2 million that we sent right to them. We did 1 million to pharmacies so they'd be in the local communities and in places where folks trust. I'm in DC right now. I just went out to the southeast part of DC, which is a predominantly Black community, to the grocery store there that has a pharmacy, and witnessed, you know, folks from the community who that's their trusted place to go getting the vaccine. So we're targeting local communities, community health centers, and also tracking it around the racial disparities in terms of accessibility, to make sure that that is not an issue. Mobile vaccination units are another way that we are working on making sure that there is accessibility. And in Chicago, we are building a new site at the United Center in Chicago, which is going to open on Tuesday, March 9th. I will also tell you that on Thursday, March 4th, going backward, the appointments will start for people who are 65 and older. And then on Sunday, March 7th, if there are any appointments left, slots will be open to essential workers and first responders and adults with underlying health conditions. But I'd like to have your listeners go to ZocDoc.com. It's ZocDoc.com/vaccine, so folks can sign up for appointments to get the vaccine.
Speaking of inequities, the pandemic and vaccine rollout have only underscored racial and economic inequities in this country. What will your administration do to change this? And will you use your authority as Vice President to include a $15 an hour minimum wage in your COVID relief bill?
So in terms of inequities, listen, first of all, we have to recognize that when we talk about equality, which is something we've all been fighting for forever, and those who fought before us were fighting for it. But this is a fight that is about making sure people end up in the same place, right? So when we talk about equality, we have to appreciate that there are folks who start out on first base and there are folks that start out on third base. And so if we're talking about giving everybody an equal share, folks will not be able to catch up. Equity is about making sure that people end up in the same place. So when we look at it in terms of how we're targeting the vaccines, when we address, for example, what we are doing around minority-owned small businesses and making sure that in the first 2 weeks of the distribution of support for the PPP, that small businesses that have 20 or fewer employees are first in line. We know that the majority of Black-owned businesses are in that category. These are the kinds of things we are doing to deal with racial equities. Minimum wage, I mean, you know, you're right to talk about that. I have been fighting for $15 an hour minimum wage since the beginning of time, it feels like. Most people may not understand that $7.25 is the current federal minimum wage. You know what that means? If you work 40 hours a week at federal minimum wage as it currently stands, you are earning $15,000 a year. $15,000 a year. which means that folks who are working a full day's work, a full week's work, are existing below the poverty line. We have to increase minimum wage. And we are going to fight for that. We're not going to give up the fight, even though the parliamentarian said that it can't stay in our bill. But it is one of my biggest priorities. The last numbers I saw, the dominant population who are minimum wage workers are women and women of color. And so there is a direct connection between minimum wage, what it stands as, and how folks of color, in particular Black folks, are doing economically.
I just want to follow up. Given that parliamentarian rule, will you use your authority as vice president to include it in the relief bill anyway?
Well, listen, we were very disappointed in the parliamentarian rule, but we are committed to working with Congress to determine the best path forward. And the bottom line is nobody in our country should work a full day's work and work 40 hours a week and live in poverty.
We're going to hear now from some people who have firsthand experience with getting the COVID-19 vaccine and what it was like for them. So now we'd like to welcome Anthony Williams from the University of Chicago, and he participated in the trials for the Moderna vaccine. Allison McCann Stevenson works with the Knight Ministry, which is a social service agency here in Chicago, and Lynette Stokes is president of South Suburban College in South Holland. We're going to hear you all talk about history and we're going to be talking about history and mistrust tonight, but we wanted to hear just from you about firsthand experiences with getting the shot. If you have questions for our guests about what it was like to get the shots, please drop them in the comment sections wherever you're watching tonight. Anthony, I want to start with you because you not only got the Moderna vaccine, you volunteered for the experimental trial. Tell us about your decision to do that.
Yeah, my decision to do that, I could probably say it's generally twofold. So first, the Black people don't enroll in clinical trials. Just, Black and brown people don't do that. And in my own practice as a prostate cancer biologist who focuses on studying the biology of prostate cancer disparities in African Americans, I spend a fair amount of time, trying to recruit patients and trying to encourage people to enroll in clinical trials. And it's a lot of the same thing repeated. And the effect of that is that because we're not enrolling into these trials, our data are not present. And so we can't determine efficacy specifically for our community. And so this helps feed into the cycle, right? Is that there are now next generation treatments and next generation diagnostics available for which we may or may not, they may or may not work for us. And so it was important from that standpoint. And then second, I would say that generally speaking, I think that Black people need to operate from a position of agency and power in this process. And so enlisting into this effort represents symbolically doing that. It's saying, no, that belongs to me too. And I deserve that. And I need to be a part of this. And so I'm going to put my skin in the game. And now I have agency to claim what's rightfully mine on the back end.
What was the experience like being involved in a study like this?
Generally speaking, it was great. So I was enrolled in a trial at the University of Chicago, and the research nurse coordinators and the principal investigators were very informative and kind of walked me through every step of the way, answered my questions anytime I had phone calls, anytime of night, morning, so forth. So it was a great experience overall. It was a little nerve-wracking though, right? That like when the needle is about to go into the arm, it's like, one, I don't know what I'm getting, and two, I don't know what's going to happen. But the risk is worth the reward, I think, and that's why I went through with it.
And you're okay. Nothing untoward has happened to you.
I am okay. 10 fingers, 10 toes still. Whatever was wrong with me before is still wrong now, and vice versa. So I'm A-okay. I had a little bit of an immune reaction after the second shot. After the second shot, later that evening, chills, fever, body ache. And by morning, I was back to Zooming and what all the rest of us are doing. It basically went away as soon as it came.
Okay. Allison, can you talk about your decision?
Hi, everyone. I made the decision to get the vaccine because of access. When I learned that it would be available to me as a staff member working with the shelter population of our homeless citizens here in the city, that's what changed my mind. Like many people in our community, I felt like it seemed pretty fast that we would have a vaccine. When a little bit of us that know a little bit about vaccination, we know that it takes a long time to get a vaccine approved by the government. So that was kind of my apprehension and then fear. But then the other thing was, while I have older parents and they've done very well kind of staying isolated since the beginning of the pandemic. And we all have, our family was touched by another family member who unfortunately we lost one of my family members to COVID. And so then that kind of really made it like really hit home, like this is real. And having access to me, when I knew, and I also heard that there was concerns about the number and availability, and so I wanted to make sure that I could at least get it when I had an opportunity to, and I did. So my first vaccination was at Olive Harvey College, and the process was very, easy and seamless to register online. I got it on the 21st of January, and that evening, I think I had some irritation at my injection site, but that passed after a few days. And then my follow-up vaccine, I got the Pfizer vaccine, which was the 2-shot, and that was on the 11th of February. So after that one, I felt tiredness. So just for one day, and that's really the only side effect I would say I had. So I was very relieved of that. It allowed me to be able to share, more openly, having the experience with colleagues who may have still been on the fence, clients and family members who still may have been undecided, about taking a shot. I feel like it's something that we must do.
Mhm.
And Lynette, what's your experience been?
Good evening, everyone. I, like many of my colleagues and people of color, was very, very apprehensive for all of the same reasons that we've already talked about. But in education, I try to lead by example. So I was watching the news reports, I listened to the scientists, I listened to the medical experts, and then I made an informed decision. It was a personal choice that this is something that I wanted to do. I can give you 500,000 reasons across the state, across the US, of people who've died, who've lost their lives. And for that alone, that 500,000 people, I wanted to live. I wanted to be here. I have an 87-year-old father, and I didn't want to just tiptoe around not being able to see him. I have grandchildren. So for that, it was a personal choice. And while we've not mandated the vaccine at the college, we wanted to, I wanted to lead by example. I'm sharing information. I'm trying to educate our community that this is the best way. This is how we save lives, and we want to be here. I had to take the vaccine in order to lead by example. So, and I did take the Pfizer as well. We at the college, we are a mass vaccination site, and we're in the heart of the community. So I took my first, when my group came up, I took it February 1st, the first shot. I didn't have any side effects, a little soreness in my arm, and that was it. I took my second dose on just last Saturday. And little bit of a runny nose, some flu-like symptoms, but other than that, no fatigue, no headache, no nothing. And it was worth it. The benefits outweigh the risk.
We have lots of questions about side effects, and we got a comment from Kenneth on Facebook saying their arm hurt for days after the shot.
Mm-hmm.
And it sounds like you all had different kinds of side effects, but you got through it. It was okay.
Yes.
Yeah.
I really kind of liken it to any other inoculation you probably get, especially, those deep intramuscular ones, like flu shot. Your arm is maybe itchy,
Mm-hmm.
or, at the side, or a little stiff, but it was nothing beyond a day, maybe two.
Oh, go ahead.
I'm sorry. And the team that worked with me, the National Guard, they were absolutely amazing. I felt absolutely nothing. I turned to her and said, okay, you're joking. You didn't do anything, right? It was absolutely painless. And I am the biggest, the worst patient ever. I cry at the drop of blood. But yeah, it was good. It was a good experience. They made you feel as comfortable as possible.
I would add to the team at Olive Harvey. It was the same, very well organized, very engaging. They really did a great job at just kind of easing your concerns. It was fantastic.
Have you all had conversations with friends or family members who are skeptical? And do you feel like a vaccine ambassador now that you were on the early end?
Absolutely.
I do.
Absolutely.
Yes. I do. I feel like, and kind of back to the scientist hat, that was kind of a positive externality of taking the vaccine, is that, I'm the one that in the family that people are usually turning to explain certain things scientifically and so forth. So having said, oh, by the way, I did it too, kind of gave a little bit more help in the cell.
And I think I heard that you might have been teased about growing a third head because you were in the trial from somebody in your family.
Yes.
Yes. Yeah.
Yes.
My daughter was sending me little emojis saying, okay, I see that arm coming out of your head. And I'm like, okay, I'm going to be here, Yeah.
Right. I will say though, that I would say the majority of people I've spoken to that were skeptical before, and even after conversation, even after data, even after I sit down and explain this, is that that skepticism remains, right? And I think that speaks to a culture of distrust. It's not just distrust that, it's not like, oh, well, if I explain this deep enough, then you'll finally get it. It's like, no, I just don't trust this apparatus. So I hope that we leverage this moment. Obviously, the things that we're doing now are so important, right? We're kind of getting the word out and talking as much, and what WBEZ is doing is amazing. I hope that's in context of taking this moment to attack that culture, right? And putting the groundwork in place so that the next time this happens, that we're not, scrambling, trying to figure out how to get Black and brown people to take this.
Because there will be a next time.
And there will
probably in our lifetime.
Right.
Yeah.
Lynette, Allison, what are you saying to friends and family who are skeptical?
Well, when I spoke to my spouse and told him I'd made up my mind about getting the vaccine, and he was concerned. And then after, I had no side effects or anything like that, I'm fine. I encouraged him to do it when he got the opportunity to do it. And his employer early on launched a testing kind of initiative. He worked for a manufacturing company, but he said he wouldn't. He's against taking the vaccine, and he's not like a person that really likes medicine or the doctor. And so, the concern for me is, if we have this opportunity to get it, why are you making an informed decision to not? So that's concerning to me, that even within my household, that apathy or that ambivalence, exists. And so, that's just a concern. And I know that that's a concern abroad. That's the issue that we're seeing in the community.
Is your husband watching tonight?
He's here.
So
Yep.
maybe something he hears tonight will
Mhm.
I hope so.
have an effect on him.
I hope so. I hope so.
My approach has been one of just a little bit more gentle approach and having casual conversations about what's happening in the world. Have you watched the news? My conversation has pretty much been with my 87-year-old father, who think the world is coming to an end tomorrow. And so just having, educating him about the vaccine and talking to him very candidly. Well, why do you have concerns? What is your hesitancy? And you are up now. Are you interested? I don't try to force it down anyone's throat, but I've been the sacrificial lamb in my family since I'm the first one up. And I've gotten calls. Well, how are you feeling? I'm feeling great. I think this is something we should do. But this is your personal choice. Find out a little bit more information. That's why it was important to me. Find out why it's important to you. And so and one of my family members who, for religious reasons, I thought adamantly she would not. Her entire family is now getting ready to sign up when their turn comes. Because again, hearing hearing the alarming number of African Americans who've died, and we all know someone or someone very close to us. And so I think that alone, we're having those discussions, and then they're hearing about what's happening is helping them turn the curve and say, yes, this is something that I want to do.
What do you think the balance is between healthy skepticism and just outright distrust?
Yeah.
I think that's I think that is in some respects a product of my community. When I say the biomedical research healthcare apparatus is how well do we communicate what we're doing, why we're doing it, when we're doing it, and how it works, right? I would say I would give us a solid F historically in the ability to do that and do it consistently. And so a byproduct of that is that there's a vacuum, and a lot of nonsense can be filled in a vacuum, right? And so I think just using the scientific method, we're skeptical of everything.
Right.
That's just how it works. All we do is spend time poking holes in each other's hypotheses, right? And so healthy skepticism is great and it's welcomed, right? But when it's filled with nonsense, right, and we have no better ability than we've ever had in the history of man to fill spaces with nonsense, right, with social media and YouTube and so forth, right? And so I think that will largely be incumbent on our ability moving forward to fill these spaces with pure factual information in digestible units for the public to understand, and not just in our weird jargon.
Can I just add to what Dr. Williams is saying? Natalie, I also feel like our community, it's awareness and education, but a lot of that skepticism is based because you don't really see people in practice that look like you. So, it doesn't take a lot of information or education, right? You don't need a college degree to know that communities of color are studied, right? And it's always someone that's not a person of color that's studying a community of color. And so for many people, they don't want to be studied. And then when you have no feedback, there's no one that's coming into the community to educate you on why we're here, what this is about, and how it's supposed to help. That's something that I think the system, at large needs to deal with. So our universities and folks that do the research that's so beneficial and necessary, we need to do more to kind of promote equity in even those spaces where we see a reflection of us. And so, I mean, but this is wonderful that we're doing this tonight because it could start.
Anthony, some of the skepticism is, how did this vaccine happen so fast? And you're a cancer researcher, and sometimes the question is, how come we have a vaccine and we don't have a cure for cancer? That's apples and oranges, but I think people need to understand, because people are not scientists.
Yeah. So you said it. It's apples and oranges. It's two different things. So kind of to try my best to answer kind of all of that at once.
Yeah, in 2 minutes.
to do my best to answer all that at once. So why do we get a vaccine so fast? Well, first, the technology that went into making this vaccine has actually been under construction and heavy work for about the last 30 plus years, right? And then when you layer on top of that, there has been infrastructure put in place for the study of other things. So for instance, there's been probably for my lifetime, an effort to develop a vaccine against HIV. And so in order to do not only the lab research, but the infrastructure and the funding and the bodies and the minds and the administration, everything about it, what that takes, that infrastructure could be easily pivoted, right? And then from a science standpoint, also, the mechanism by which this vaccine works is fundamentally different than many others, right? And so it doesn't require the same length of time for its development, right? And then when you layer on top of that, nearly every scientist in the world stopped what they were doing and focused on this, right? And so it's more, I say it's less skeptical, or I'm less skeptical about how we did this so fast, because historically I've seen us do crazy stuff when we fix our mind on it, right? It's more so evidence that we can actually do things if we really commit ourselves to it, right? So maybe we should say commit ourselves to ending healthcare disparities in the next 30 years, right? It sounds like a lofty plan, right? But it took us 9 years to put somebody on the moon with no idea how we were going to get there, and no infrastructure and no plan. We just knew we wanted to do it, and we committed to doing it. So why don't we commit to doing this?
Wow. Well, we have to move on to our next panel. But I want to thank each of you for sharing your experiences. Anthony giving us a quick dissertation. Again, thanks so much. To our audience, a reminder that we are trying to work in some of your live questions tonight, so drop them in the comment threads wherever you're watching. Now it's time to get to some specific answers to your questions from the people who are making some of the big decisions about vaccines for Chicago and the whole country. I want to welcome our next guest, Dr. Allison Arwady. She's the commissioner of the Chicago Department of Public Health. She's in charge of the City of Chicago's response to the pandemic. Dr. Lisa Green is the CEO and co-founder of the Family Christian Health Center. She works with underserved patients in Harvey and the South Suburbs. Dr. Archana Chatterjee is Dean of the Chicago Medical School at Rosalind Franklin University. She also serves on the Food and Drug Administration's Vaccine Advisory Panel, where she votes to authorize COVID-19 vaccines. And Dr. Chatterjee, we are grateful you can join us tonight, given your role with the FDA, but you also need to make a note about that.
I do, Natalie, and thank you very much for inviting me to be part of this panel today. Any information I provide and my opinions on requested questions are completely based on my own personal and professional knowledge, understanding, and expertise only. My expressed opinions on the vaccine's approval process do not necessarily reflect the opinion of either the Vaccines and Related Biological Products Advisory Committee or the FDA, to which the committee provides only advisory services, and they should not be misconstrued or misinterpreted. Also, this information does not directly or indirectly bind either the committee or the agency that is served by the committee. Lastly, I am required to complete the FDA's conflict of interest screening forms provided before each meeting of the work pack. Thank you.
Thank you for that disclaimer and explanation. Now let's start with some really basic information about vaccines. Dr. Green, what is Family Christian Health Center doing around vaccines? Are you a site?
Yes. Oh, yes. Thank you so much for the opportunity tonight and just the panel of people that you have. So at Family Christian Health Center, we began giving the vaccines early in January. And I will tell you, the first people that got vaccinated were our healthcare workers, because what we realized is that the first thing that my patients are going to say is, Dr. Green, did you get the shot? And so it's going to be hard pressed to have everybody else, even of our staff, to tell our medical assistants and our nurses if the providers weren't on board with getting the vaccine. And so we began to vaccinate our staff first, and then after that, the community. And now we've taken an opportunity to really educate not just the staff, but our patients in the community, our neighbors, to say the fact that we've got the vaccine, we're okay. Like someone mentioned before, I didn't grow a third arm, it's not the mark of the beast. There's not a computer chip. I mean, there's such a long history of injustices and distrust within our communities that this vaccine, I think, has an opportunity to actually heal some of that as we begin to embrace people and educate them with information that helps them make wise choices for their family. And so Family Christian Health Center, it's a very qualified health center. What we've really taken the time to do is to dismantle some of those myths and give people a safe space to ask those real questions. I mean, they can't ask a question to a PSA or someone who's out on the television, but instead they're able to come in and say, you know what, I'm scared to do this. Is it gonna affect me if I get pregnant 5 years from now? What are the long-term side effects? And so using this as an opportunity to educate people and to build that trust is going to be paramount, because they will be the same people who will go back in to talk to their family members and their neighbors and their relatives to say, it's okay, and this is why.
Dr. Green, did you run into any resistance from your own staff or the community, and how have you dealt with that?
Oh, absolutely. And I will tell you, our providers at first, and we talked about it when we first got the first vaccines, we were like, oh my God, it's time for me to go now. So there was some hesitancy, because at the end of the day, right, I am still a mother, I'm a sister, I'm a neighbor, I'm an aunt, you know what I mean? So all of those things come in. And so you can have all of this knowledge that we know that it's safe and look at the studies. But when it came time to actually get the vaccine, for several of our providers ourselves, we were a little nervous at first, but realizing that if we were that way and we have spent time years, imagine how our patients feel. So that way you have to really take a pause back and understand where they're coming from. And so if they don't have medical degrees, they're not, they haven't spent years in this. And so if I have that, then I need to acknowledge that and be able to acknowledge that their myths or concerns that they have, right or wrong, that I provide an unjudgmental space to be able to address that. And I think that's the first thing that you have to do. So we've had those conversations among our staff first, and now embracing that in the community. At Family Christian Health Center, we did a program this summer called One Community, One Church, One Voice, where we really tried to go out and do COVID testing. And I think as we build those relationships with people in the community, and you're able to see the fear and the concern in people's eyes, they now see us as a place and a safe place to ask those questions. And I think that's why it's so paramount that you have information at a grassroots, at a level that people can understand.
Looks like Dr. Green froze, but I am going to turn to you now, Dr. Chatterjee. We heard Dr. Anthony. Oh, okay. We had a little hiccup there on Zoom. We're going to turn to Dr. Chatterjee now. We heard Dr. Anthony Williams talk a little bit about the science, but the COVID-19 vaccines are a new type of vaccine called mRNA. Can you talk a little bit about how vaccines work in general and how COVID-19 vaccine works?
Certainly. So, vaccines have been around for more than 100 years, and we have different types of technology, and those technologies have evolved over this century that we have had vaccines available. The older technologies of growing viruses or bacteria in the laboratory, in animals, trying to make vaccines that way takes a long time, as Dr. Williams was alluding to. The newer technologies, one of which is the mRNA technology that has been deployed for 2 of the vaccines, for the Pfizer and Moderna vaccines, are a very different way of making vaccines. These do not require us to grow anything in the laboratory. They're basically a synthetic chemical mechanism by which the vaccines are made. And the portion of the vaccine, the spike protein, which you've heard a lot about, which everyone's heard a lot about, the mRNA is actually a messenger RNA. It's a code for that protein. And that is inserted into a lipid nanoparticle, a little piece of fat, if you will. And that's how those vaccines are made. And so it's very easy to change that mRNA. As you know, we've been hearing about these new variants and, do we need new vaccines? Well, using the old technology, it would have taken us months, if not years, to grow up those viruses and again, try to make the vaccine that way. Whereas this particular technology allows us this flexibility to change the vaccines if we need to very quickly. The most recently authorized vaccine from Janssen uses a different technology. It also uses a carrier, and these lipid nanoparticles I was talking about, these are carriers. Basically, they just help to carry that mRNA into our cells. In the case of the Janssen vaccine, or the Johnson & Johnson vaccine, as a lot of people are calling it, it's a different carrier. It's another virus, which is been inactivated in the sense that it cannot replicate, it cannot continue to grow in our bodies. It's an adenovirus that has become the carrier for this particular message for the protein. And so we are using multiple different newer technologies, but as Dr. Williams pointed out, some of these technologies actually have been in development and in use for a very long time. The adenovirus technology for the Johnson & Johnson vaccine, for example, we have used this technology for decades to make other vaccines, and we actually have a licensed vaccine most people don't know about. That is the Ebola vaccine, which was licensed in 2019 and uses that exact same technology. With regard to the mRNA vaccines, those vaccine trials for other vaccines, not for COVID, but for some childhood vaccines, for example, we have been using those technologies for about 10 years now. None of those were licensed yet. Those trials were still ongoing when COVID hit. And so basically that technology was shifted over to focus on the need of the hour, which was for COVID vaccines.
I want to ask a quick follow-up question. This is something we heard a lot from our surveys, people asking whether the COVID vaccines out there now can give you COVID. Can they?
They cannot, because there is no live virus in any of the vaccines. What is there are these messages, these codes that help our immune systems, our body recognize that spike protein and say, aha, there is a foreign invader. There's no invader, there's no virus. It's a piece of the virus that the body sees as it's in some ways, if you might want to think about it this way, is it's tricking the immune system in triggering an immune response, which is what we want, even though there's no live virus there.
Dr. Awady, we have a question from Katie from Inglewood who wants to know, do the vaccines still protect against the different variants of COVID-19 we're hearing about? And then I just want to add on that quickly. What happens if you miss your appointment for the second dose of the vaccine? Do you have to start all over again?
Sure. And thanks very much for having me. So I'll take the second part first. If you miss that appointment for the second dose, we do want you to reschedule that appointment. If you miss it right on time, we still want you to get it. You can get it delayed and it would still count. You would not need to start over, but we really want people to get that second dose on time, partly because of the way we distribute vaccine. We send the second dose to the same place where you got your first dose on time for the same number of of people to get the second dose. And so if people are missing those appointments, sometimes it can get hard, especially while vaccine supply is still low, to be able to fit in there. So do get that second dose. If you miss the appointment, call the same place where you got it. They'll work on getting you in, but do try to get it on time, because particularly with the Moderna and the Pfizer, that full 95% protection that we've been so excited about comes after the second dose. And we have seen some people not come back for the first one, and you're not getting the full benefit of the vaccine. So to Katie's question, remind me.
Sure. Do the vaccines still protect against the different variants?
Yes, thank you. And this is a great question. And this is something that we are still, it's one of the main areas of research. As of right now, the answer is yes. All of the available vaccines here in the US, all three of them, have good protection against all of the variants that we know of and all the variants that have emerged. What the concern has been is that we don't necessarily see the very full, maybe you don't see the 95% protection. You start to see that backing off just a little bit. But the bottom line is that we need people to get vaccinated now when they have the opportunity, because that's what helps protect against all the variants that are out there now. It really gives the best possible protection. I sometimes get the question, should I just wait because maybe there are variants coming, maybe there will be a better vaccine? No. Get the vaccine now. It protects against the variants now. And all of these scientists that have been working on all the vaccine, they study every time a new variant emerges, they test all of the vaccines against that variant. And if we were to see additional problems in the future, we would address that. But get the vaccine now. You're protected against the variants. And again, these vaccines continue to perform in the real world like they did in the trials. The news really couldn't be better there in terms of having amazing protection, keeping people out of the hospital, stopping deaths, and generally protecting individuals, families, and communities against COVID. So it's been amazing news in terms of how this vaccine is performing.
And it's not unusual for variants to happen, right?
That's right. Every virus always mutates. Mutation is the word that we use where a variant can emerge. And if you think about the flu vaccine, right? Every single year you have to get a flu vaccine, partly because there are a lot of variant is a term that we use when there are changes in the virus. We'll sometimes use the word strain if there's completely sort of new versions that have emerged. We've not actually seen the COVID virus mutate that much at this point. And that's why at this point you get the vaccine dose that's available, you're generally protected. But the scientists do study this. And one of the reasons why we've been really emphasizing that along with getting the vaccine when it's your turn is that for right now, we do need people to keep wearing the mask, doing the social distancing, doing everything that's got us this far, is because those things that you are doing also help protect against variants. And as our rates are going down, our case numbers are going down, the risk becomes lower for everyone here in Chicago. So it's a mix of both getting the vaccine, doing the things that have gotten us this far. And right now I'm feeling very confident about where we are related to variants. I think a big part of this conversation is going to be, you probably heard President Biden say that by the end of May, they're now anticipating to have enough vaccine available for all Americans. But we live in a global world, and where we are seeing viruses and variants, emerging in other parts of the world, it's going to be really critical that we work, from an equity standpoint, not just here in Chicago, but globally, to make sure that this vaccine is also being made available across the world so that we think about protecting against variants.
Before we move into history and distrust, which were big themes in our survey, I want to ask really quickly this question from Rhonda, who's from Chatham. Once you have received both doses of the vaccine, how long will you be protected from contracting COVID-19 in the future?
Yeah, so we don't fully know the answer to that question, partly because, again, we've only known about COVID for a year, right? And we've only had the trials where we're following people. It's still less than a year. I think the big question there is what's going to happen with variants in the future. At this point, everybody from the very earliest days that we're in these trials continue to have good levels of protection against COVID. So what we can say is that, getting this vaccine now, getting both of the doses, if you're getting Moderna or Pfizer. And there's not a plan at this point saying a year from now you would have to get another vaccine, or 6 months from now you have to get another vaccine. I can't completely rule that out because we don't know for sure what may happen with variants, but this is not like the flu vaccine where we know every year there's going to be a new vaccine. It's more seeing what progresses. So you get your vaccine doses now, you're considered protected. The scientists are going to keep working on it, and we'll see whether this is something that needs a booster dose or not down the line. But right now, you get it and you're done.
Okay, let's go to our first live question tonight from one of our community partners at Something Good in Inglewood.
Hello, hello, hello.
Hi, Justin.
Hi, my question is for the healthcare professionals online. Good evening. I had a quick question. What can the healthcare professionals and vaccine providers do to build trust within the Black community outside of COVID, just on a regular basis, so we are not fighting so hard to to get persuaded to take the vaccine that will ultimately save us, essentially?
I'll answer that as a family practitioner. You're absolutely right. We have to do a better job of creating an environment that is a safe space for people to ask the questions and to acknowledge some of the disparities that have existed. So if we look at what's happening right now, we've asked people to wear a mask, social distance, help your kid with Zoom. Did you get your mammogram? Did you get your PAP? I mean, we've asked people a lot. And so what we have to do then is to be able to break that down so the information that we need them to be able to empower themselves to make wise choices for them and their families is to take that information down and to relate it to them so that they can understand that. There are a lot of people that don't even understand what herd immunity is. There are a lot of people that don't understand what this resistant strain is. What does that mean? And so I think that as we begin to acknowledge the disparities and the gaps that COVID has uncovered, then we now have the opportunity to build better relationships and answer some of those questions that we are able to then empower them. And so when you look at a young mom, for example, who's coming in and she's got 2 or 3 kids, and or even someone who's just finished college and they're coming in, you have to understand where they are. And once you understand where they are, then you're able to take information to break it down to them so that they can then own that. We have to take away from all of the technology and some of the words that we use, but relate it to people. And once you can do that, then they can understand that and then they can own that, but in an environment that also acknowledges that they have this distrust, that they have over a period of years looked at what's happened in their communities and in their families. So a lot of people haven't had to go far to see some of the disparities that have existed. So if we take that and understand that's where we are, it allows us an opportunity to build a better bridge, a better relationship for our communities. And once you empower them with knowledge, they're the ones that become really good grassroots, because then they spread it to everybody else and they spread it to their other family members. Oh, you know what? I went to the doctor and I found out, guess what? This is really why I need to go check my diabetes. This is really why I can't eat certain things. And once they understand that in the middle of COVID and everything else, they become our best voices for the community.
And maybe I'll just add briefly, I'm a primary care doctor as well. And when I've got patients that I've been seeing, for years, and I'm very used to answering questions, talking about what are issues, it's really building up some of this trust with providers, that Dr. Green is referencing, that then when you're having the conversations about vaccine, that is built sort of on a history of talking about issues honestly and openly. And I think, part of the reason why we've really been pushing hard in Chicago to get vaccine out to providers like Dr. Green, right? Like out into communities, is because we know that the best way for folks to get vaccinated is for, the healthcare provider to say, let me make you an appointment, let me get you in, you should get the vaccine, here's why, and then have that chance to have that individual level conversation. We think, honestly, especially where we're thinking about addressing some of these inequities, it's not all about standing up a mass vaccination site with a big online platform. It's about getting the vaccine to the folks who are already have that trust, have that conversation, and whether that's, ideally a family physician or a primary care provider, if not sort of a regular pharmacy provider, but, there's various ways this can go. But I think it's about, you want to ideally have this relationship, and we like to get questions. I love getting questions about vaccines. I want people to feel confident in taking the vaccine, and they're only going to feel confident if they've had a chance to ask questions, in a non-judgmental space from people who they know that there's already a shared, sort of a shared relationship around wanting to promote health.
Great. We have another live question from Bradley Johnson with Build Inc.
Hi, everybody. My question is, I've heard from a few African-American healthcare professionals who have refused the COVID vaccine, and they cite the warp speed that it was described as being created, and then a lack of adequate time for research. And then others even said like they fear they won't be able to have a baby. So how will you address this concern?
So, Mr. Johnson, if I may try to address your questions first. With regard to the speed at which the vaccines have been developed, I think Dr. Williams set it up for us initially to explain how some of these technologies already existed and were sort of repurposed towards creating these vaccines. Actually, there was concerted effort, not just by the scientists, but by the whole world in terms of governments financing and supporting these vaccination efforts. The pharma manufacturers, of course, stepping up not only with the research and development, but also with manufacturing. One of the things we did with these vaccines, which we've never done before, is to start making the vaccines in the factories before they had been authorized by anybody for use. Typically, what happens is there is this regulatory process of the FDA and other regulatory agencies in other countries where the manufacturers take all their research to them, they get authorized or licensed, and then only after that they start making the vaccines. Given this deadly pandemic that we were in, this decision was made to start making the vaccines so that as soon as the authorization came, they could start shipping the vaccines. And you saw that with the Johnson & Johnson vaccine. The authorization happened over the weekend, and by Monday, they were able to start shipping vaccines. That is unheard of, okay? The participation of people like you heard on our first panel, being willing to step up and be participants in these clinical trials so that the clinical trials could move forward quickly. The way we do clinical trials was done differently. Usually we have different phases of trials. So you do, phase 1 trial with a few number of people. We look for side effects. Then we do a little bit bigger trial and we see if the vaccine works or not. And then we do the big phase 3 trials, which are usually placebo-controlled or some other kind of control is used. And that all takes a long period of time. This time, all that was compressed. So we did phase 1, 2 trials together. In parallel, we were running phase 2, 3 trials together so that you could start to gather these data very, very quickly. So a number of things were done to speed up the process that didn't necessarily cut corners or abrogate some of the safety measures that are in place to make sure that the vaccines are safe to be administered. I'll say one last thing about my committee, because typically what we do is we see the data and we decide how much data we need to see in order to recommend to the FDA whether something should be authorized or approved. In this instance, the agreement we came to was that we would look at 2 months after the final dose of the vaccine was given. That 2-month cutoff was used because most adverse effects, most side effects of vaccines occur within about 6 to 8 weeks. So we knew that we would be able to see most of the side effects. So the safety was the first thing that we wanted to look at. We also knew that we would get data on the efficacy, on the antibody levels, et cetera. And so that's why we didn't wait the 2 years. And this is something I think very important for this audience tonight to know, Natalie, is these trials are not over. All of these trials are still ongoing. Data are still being gathered as we speak. Most of the trials will go on for 2 years. And as Dr. Arwady pointed out, we will gather a lot more knowledge and information. But in the meantime, we have a weapon now against this deadly pandemic.
Okay, I want to get in some quick questions about some of the things people have heard about these vaccines from their friends, family, and social media. We're going to take a look at some of these things that people have dropped in the comment sections tonight. So if we can do this quickly, lightning round style, and get through these answers kind of fast. We've heard from lots of people who say they don't need the vaccine because they never got COVID. Is that how it works?
No, so I'll take that quickly. So we really, to protect yourself, your family, your community, we really do need everybody to take this vaccine when it is your opportunity. And I think particularly with the focus, on Black Chicagoans today, we've seen very disproportionately deaths and hospitalizations in Black Chicagoans. And because you haven't gotten COVID yet, thank you for doing the things that you did to help protect yourself. If you were wearing masks, if you were social distancing, but those are not as protective as getting the vaccine. And getting the vaccine is literally giving you a 95% protection against this vaccine. Against this virus. It's one of the best numbers we've ever seen. And there have been more than 660,000 vaccines here in Chicago, more than 80 million across the country without any signs of concern and with very good signs of the vaccine working well. So whether you've had COVID or you haven't had COVID, you really should get this vaccine.
Will this vaccine make women infertile?
I can try to answer that question, Natalie. I think this is a myth that is being propagated, unfortunately, through various mechanisms. I think the concern is based on the fact that we do not have large numbers of women of childbearing potential that were included in the clinical trials. That was done on purpose. When we're testing new vaccines, we typically do not include vulnerable populations like pregnant women or women with the potential to become pregnant. Having said that, despite the fact that they are screened and they're supposed to practice pregnancy prevention measures, a few, very small number of people did become pregnant during the participation in the trials. The good news is that in terms of those who got vaccine and those who got placebo, there were no differences in the pregnancy outcomes. Now we're talking very, very small numbers, a couple dozen here, a couple dozen there, in trials that had tens of thousands of people that were enrolled. Many of those pregnancies are not complete yet. So I go back to my earlier comment that we are following those people, those participants, and looking to see if there are any risks. But at this point in time, there is no concern. And from a biological plausibility standpoint, is this possible? Is this likely? It's extremely unlikely. There are no vaccines that cause this kind of problem. So it's not something that I think people should be concerned about.
One man said he won't take the vaccine because he believes COVID-19 was man-made and he doesn't trust the government to give a safe vaccine. How do you respond to that?
This is another myth that is out there, and the scientists have actually addressed this over and over again. There are actually pretty easy ways from a scientific standpoint to tell if something has been bioengineered or man-made, as the questioner said. This virus is not man-made. It has occurred and emerged naturally. These viruses do come out of animals usually and get into the human population and cause these types of infections. It's known not just about coronaviruses. It happens with many other viruses. Influenza was mentioned earlier. And so these things happen, and this is a myth. This is not a reality.
Paul on Facebook says a neighbor of his thinks the government is using vaccines to put chips into Black people to control them.
No, and I'll answer that question.
Go ahead, Dr. Gray.
Yeah, so no, I will answer that question. People have so much concern about this chip and it's the technology. I said, how many people have a cell phone? I said, how many people are on Facebook, Instagram, social media? You know, that technology that is being inserted is not that. It's taking a picture. It is not going into your DNA. It's not changing your mRNA. It's not doing any of those things. But what people have to look at is if the people that have died over the course of the year and their communities and those families that have been devastated by that, that's what we have to take a look at and focus in on that. When we focus in on that and you weigh the two, there's a huge difference in why we need to take the vaccine to protect our families. And so if we continue to just look, we can always find reasons to go against something. We need to look at the facts of what we're facing and take that facts to dismiss that fear. Easier said than done. And that's the importance of people having a relationship with a primary care physician that they can ask those real questions to, because I can talk to you about the chip, but let's talk about the diabetes or the hypertension and the risk of COVID. Those are the things that you have to be able to empower people with so that they can then make the best choices besides what they see on social media.
Lots of questions tonight about folks asking whether vitamin D can reduce the side effects of the vaccines.
So I can try to address that. There are a lot of studies on vitamin D in terms of does it modify the risk of infection, the outcomes in terms of reducing severe disease, does it have any impact on the vaccines? I would say that the jury is out as far as the impact of vitamin D is concerned. There are a number of studies that indicate that vitamin D may have some sort of a protective effect in reducing the severity of the illness from this virus, or in the chance of catching this virus. There are an equal number of studies that show that there's no impact at all. And so I think the science is messy in this area. And this is one of those areas that we'll have to wait for more information to come from research to tell whether vitamin D really has a role or not.
And we have a live question from Martha Bell, who's a member of Alpha Kappa Alpha sorority, Theta Omega chapter.
Good evening. I'm very happy to be a part of this presentation. My husband and I took both sets of vaccines, and we did not have a severe side effect, but I have a friend who did. My friend received her first vaccine the day after receiving an injection in her eye for macular degeneration. After arriving home from taking the vaccine, she began to experience a severe headache, and her speech was incoherent. She went to the hospital in an ambulance. The results of tests showed she had brain bleeds and had suffered many strokes. She is leaving the facility. She's in rehab. She's leaving today. She called and left me a message. Perhaps the vaccine did not trigger this condition. However, it did start within an hour of her injection. Now she'll no longer be able to live alone, drive, and just a lot of restrictions. Could this situation have been avoided? I don't think the person administering the vaccination asked her, has she had an injection or a vaccination within 14 days? And I was wondering, are there other cases where people have serious side effects?
So I can try to start on the answer. Dr. Awadi, did you want to go first, maybe?
Either way, either way, go ahead.
Well, with regard to the side effects, first of all, Ms. Bell, I'm so sorry to learn about your friend. This is a very unfortunate thing that has happened to her. Just from the timeline that you laid out, as a physician, I will say that I wish vaccines worked that fast. They simply don't. If she began to have symptoms an hour after her injection, and that the kinds of changes that happen in her brain, I think are extremely unlikely to happen that quickly after the injection. There are allergic type reactions, anaphylaxis, things like that can happen very quickly. but the kind of side effects that your friend had does not, to me, sounds medically plausible that that was caused by the vaccine. Having said that, I also wanted this audience to know that I too have received both my doses of vaccine. I got the Pfizer vaccine, so did my daughter. We both got our second dose on Saturday. I had very minimal side effects, a little sore arm, a little malaise and achiness. My daughter was quite ill with high fevers and aches and pains and nausea, etc. So there are differences in the reactions that people have. Has to do with how their immune system is responding. In terms of serious adverse events or side effects, absolutely they do occur with vaccines as they occur with many other medical interventions. The good news from the trials is that there seemed to be no difference in the adverse events in those who received the vaccine versus those who got the placebo. Dr. Arwady.
Yeah, thanks. Right, and I just wanted to echo, really sad story there. And I'm sorry for, the really life-changing event that your friend has had. I also think that it is very unlikely that it would be related to the vaccine. Some of this is because, as you were hearing, in the trials, which is tens of thousands of people, they compare half of the people get the real vaccine, half of the people get an injection with a placebo, which is basically like a dummy vaccine. It's just salt water. And then they follow everybody forward for a number of months. And there are things that happen to people, right? Like people get strokes, people get heart attacks, people have car accidents. And what happens in the trials is that you compare, do the people who get the vaccine, are they more likely than the people who got the placebo, the dummy vaccine? Are the people who got the vaccine more likely to have a stroke, more likely to have a heart attack, more likely, to die or have anything happen to them? And, no vaccine would be approved if we saw a sign that this vaccine was causing a serious side effect like this stroke. Also, the thing I wanted to note is that when there are events like this that happen after a vaccine, those do get reported. There's a lot of work that's happening just to follow up to make sure that we're not seeing any unexpected patterns related to the vaccine. And again, in the 80 million doses that have been given across the U.S., we've not seen an increased risk of brain bleeds or these serious side effects at all. Obviously, if we saw something like that was a pattern, this vaccine, would not be in use. There's very, very high standards around safety for the vaccine. I also, I don't know the details of the injections, with the eye. I wouldn't think that would have, off the top of my head, I wouldn't think that those would have any relationship to each other. But regardless, I think especially when we are vaccinating older folks, some of them will have events that they would have had regardless of the vaccine. And that's why it's so important to have done these trials well.
Yeah, and I just want to say, in Chicago here, we haven't had any adverse effects like that we've watched. If anything, it's been an allergic reaction. And I will tell you, someone asked earlier, what will we do to have other providers be comfortable when they're having, issues and concerns? I will tell you, Black and brown doctors are communicating not just across Chicago, but across the nation. So people are talking and networking with one another, trying to see, did you see anything? How is it working? Things like that. It is that communication and networking kind of grassroots nationally that is really empowering and eventually going to, I think, help us to really impact our communities.
We have another live question from one of our partners, Letitia Hollingsworth from Something Good in Inglewood. And Dr. Green, can you take this question?
Sure.
Hello. How you doing? My name is Letitia Hollingsworth, and I'm from Something Good in Inglewood. My question is, how does the vaccine affect pregnant women and her child? And what are the possible side effects will the unborn child have as far as the immune from COVID-19?
All right. So in the studies and trials, we did not intentionally do or have women participate that were pregnant. So we have not done research, and so we have not advised for women that are pregnant to actually get the COVID vaccine. Instead, what we have done is make sure that women, when they're pregnant, that they are social distancing, that they're wearing the mask, that they're sanitizing their hands and things like that, trying to be as safe as possible. But there is no study in women that were pregnant. So that is the reason that we are not advocating. However, what we do is we have each pregnant patient sit with their provider and make the best choice that's available for them, because each person has certain past medical histories, what we call it, or certain risk factors or categories or things like that that will allow them to be able to need the vaccine. But that's a decision that has to be made from the primary care physician, that OB-GYN, with the best outcome for the baby and the mom.
We have a lightning round section where the answer will be yes or no. People who want to know if they get the vaccine, if they have diabetes.
Yes.
Cancer or once had cancer.
Yes.
Asthma.
Yes.
Overweight.
Yes.
Smoke weed.
Yes. Because what else do they smoke? Yes.
Great. So finally, before we end, we want to talk about accessibility of the vaccine and the city's response to the pandemic. Right now, Chicagoans 65 and over, certain frontline workers, and people with certain health conditions in some parts of the state can get the vaccine. But there are also 15 Chicago neighborhoods where any adult is eligible. Can you explain more about this, Dr. Awadi, and how you're making sure folks in those neighborhoods are the only people taking those shots? And I want to say, like, there's some I've had friends tell me that they have been in hospitals in Black neighborhoods that are 99% Black, and most of the people getting the vaccine in the waiting room are white.
Yeah, so thanks for that question. Couple things. So the 15 neighborhoods that you're referring to are what we call our Protect Chicago Plus neighborhoods. And first, I want folks to know where to go to read some more about this. So chicago.gov/coronavirus is your one-stop shop. And then there's a whole thing about vaccine. But we identified the 15 community areas in Chicago that have been hardest hit by COVID, related to cases, deaths, hospitalizations, as well as the community areas where we have a high percentage of frontline essential workers and people over 65, and where we don't have good access to medical care, or as good. We have larger numbers of people not connected to a primary care physician, where we have crowded housing, where we have people who are uninsured, where we see lower income, et cetera. And in those 15 community areas, we've been doing some special events that are only open to members of those community areas. And that's because these are the areas hardest hit by COVID. We really want to get vaccine into those community areas because it's where we've seen a lot of the highest rates there. And so in those settings, we meet with community leaders and basically say, you tell us about where does vaccine need to go here. If in this community area, it's really being driven a lot by intergenerational households, or if it's being driven a lot by other types of workspaces, for example, that maybe were not prioritized. If you really want to make sure that these events are happening in a church, we do it. We basically provide vaccine and have been working to get those communities highly vaccinated. So you can go online if you want to see that list but they're going over February and March. So about half are predominantly Latinx, about half are predominantly Black. And it's not the only thing we do though. We also work to prioritize getting vaccine to providers in heavily burdened neighborhoods from COVID. So most of those also are predominantly Black or predominantly Latino. And we don't have enough vaccine for everybody. So this is how we fill our vaccine orders. We start with all of the providers in the most heavily hit areas in Chicago, not only just those 15 communities, but sort of in the other ones that have what we call a high COVID vulnerability. And we've been working to bring strike teams. So we've been going to all of the senior housing. Again, we start with the community areas that have been hardest hit by COVID. We've been going to all the homeless shelters. We've been going to domestic violence shelters, the skilled nursing, all of these higher risk community areas. But I love that the Vice President of the United States started off with a push for the United Center. But I do want to highlight tomorrow morning at 8:30 a.m. is when registration opens for more than 100,000 appointments at the United Center in the month of March. Those are only open for people over the age of 65 initially. And I want all those appointments, if I had my choice, taken by Chicagoans. We do work in these Protect Chicago Plus areas to make sure vaccine is only going to people who live in those neighborhoods. So we don't require a photo ID, but people have to bring a piece of mail, something that shows they actually live in that community area. But in these larger ones, like the United Center, because it's a federal state site, it's open to anybody in the state of Illinois. We can't control that. So what we can do is try to get the message out and have people hear that this is a really good opportunity. There's free rides with Uber if people need it. There's good accessibility if you've got people who have problems with mobility. We've thought about that. There's wheelchairs. People don't have to walk far. We've thought about language accessibility. If someone needs to go with a companion, we can do that. But I would like nothing more than to see Chicagoans, and ideally Black Chicagoans who are still lagging a little bit in terms of where we're seeing those vaccine numbers, take those slots because I really want to see those get used in Chicago as much as we possibly can.
What about seniors who aren't as tech savvy and have trouble making appointments online?
Yes, absolutely. There's also a phone line. So ZocDoc.com/vaccine is where you sign up online, but 312-746-4835 is the phone line. And we've got more than 200 people who are standing by, to help people make those appointments and get in specifically for the United Center. We are also doing senior focused events across about 25 of the community areas, not just the Protect Chicago Plus, but some of the ones that are other community areas that have been harder hit, bringing vaccine there. And then we are also launching a program for homebound seniors who really are unable to leave home with the Johnson & Johnson vaccine single dose. We're launching that tomorrow. But the main thing is we've really said here in Chicago, we want this to be the month where everybody over the age of 65 has the opportunity to get a vaccine. And so if you know someone who is over 65, maybe they haven't gotten this message, maybe they're not that sure about it, please give them a call. Please say, can I help you with the internet? Can you call this number? Because
can you repeat that number again?
Please, yes, 312-746-4835. And it's all available on our website too, which we can post a link to maybe.
I think we're posting in the chats.
Yeah, so I would love, opens at 8:30 and it's only open for seniors, for the first 4 days of signing up, and it'll open up further that only if seniors don't fill all the appointments.
We have a question from Rosalind, who took our survey and says she only trusts the Moderna vaccine and she doesn't want to take any other one. Can she choose which vaccine she takes or find out ahead of time which brand is being offered? And this is not just for these 15 sites or the United Center, just in general.
So couple pieces there. So, the Moderna and the Pfizer have basically the same technology behind them. Honestly, there's virtually no difference in the way that they work. You can check with your provider where you're going to be getting, once you've got an appointment, they will be able to tell you which vaccine you would be receiving. Typically, sites only have one type of vaccine. I can tell you at the United Center, we're going to be using the Pfizer vaccine, for example. But depending on sort of the setting, we use different vaccines. But when you get an appointment, in many cases, you're able to see when you sign up what the vaccine is, but otherwise, if you make a call. Generally, if you're getting, because the main difference between Pfizer and Moderna is not in how the vaccines work, it's mostly in how they're stored. One needs ultra cold storage. There's a lot more technicalities to it. So hospitals, some of the larger vaccination sites tend to use Pfizer. Moderna tends to be more in outpatient sort of doctor's offices or community events, most typically. And then Johnson & Johnson is going to kind of layer in across all of this. So that would be my advice. But really, I would really encourage folks to take the first vaccine that you have the opportunity to get.
Great. Well, we have run out of time, and I want to thank Drs. Arwady, Chatterjee, and Green for participating tonight. Also, thanks to our community partners, Something Good in Inglewood, the Chicago Urban League, South Suburban College, Austin Coming Together, and the Theta Omega chapter of the Alpha Kappa Alpha Sorority Incorporated. And thank you to the Pulitzer Center for financially supporting our COVID-19 vaccine coverage and events like this. We also want to thank all of you for tuning in tonight, and we encourage you to provide feedback in our post-event survey in the comments section. We'll also have ongoing vaccine coverage or catch up on what you missed at WBEZ.org. And you can always visit WBEZ.org/events for a calendar of more events we've got going on. Good night.